Today was a big day. This is the day that we were able to move on with the Invisalign journey. I know we were on a big hiatus, and I know most of our loyal followers were probably in huge anticipation for when we were going to continue. Just to kind of fill you in, I've been wearing my aligners just at nighttime because I've been at the standstill point, meaning I couldn't really move forward until I had this tooth taken out. Okay, I talked to you about that tooth, all the problems I have, so let's review this tooth really quickly. This tooth, way back when I was 12 years old, about 20 years ago, had a root amputation, meaning they cut off one of the roots because that tooth wouldn't move. In that process, I had a lot of recession build up, okay? And so this tooth was very weak to begin with, and then I had some recession. So what does recession mean? Excuse me, let's go here. So recession means that the gum tissue faded away, and it's hard to see back there. Let's see if we can get a better shot. There you go. See how this gum tissue receded away? And I got a cavity right in between the roots there. So this tooth had to come out for a number of reasons. One, I wasn't able to move teeth around it because it wasn't really moving. It was ankylosed, right? And number two, you can't have a cavity in your body. You're walking around with a disease in your body. So there's little bacteria inside of that cavity that is prone to spread to my other teeth. Now I have brush well and I have a good diet, so that was minimized, but you don't want to walk around with cavity in your mouth, right? So today's the day. Today was the day I had to have this tooth taken out. Now I'm speaking to you here after the fact because I wanted to talk to you a little bit about my experience. And before we go further into the video, I'm going to show you kind of the procedure. I will warn you, it does get slightly graphic. I don't show the procedure itself just because I needed to let the good doctor work and I didn't want you to see me crying. But some advice would be to dress comfortably. So a hoodie and sweatpants might be good for you. You'll notice I'm wearing pretty much this. Mine's the bow tie because I want some wiggle room. Number two, a lot of times these surgeons, they'll put you to sleep. So anesthesia. I didn't particularly want that, but I think it's a fantastic tool to use. It's so simple. They put you out, you don't remember anything, you wake up. If you're like me, I'm fine, I can handle it. But I would recommend just keeping your mind busy. Don't get anxiety. Don't think about this all day. Don't lose sleep about it. Schedule it during the week and just go throughout your week, and then just show up there, and then before you know it, you're having the tooth taken out. You'll see how easy it was in just a second here. The final thing I would recommend is, this is only if you're not having anesthesia, but I would try to eat before because I'm starving right now and I don't want to eat because I got this gauze pack in here and everything's kind of fresh. I'm gonna go grab a bite to eat, but it's just challenging. So I wish I would have ate more this morning before I had everything done. So anyways, you're going to see some awesome things on this video. You're going to see what an awesome team Dr. Forgaj has there. One thing he highlighted is he talked about his medication and what he does. This is ibuprofen and this is Tylenol. This is it's probably about 5 hours now since I've had the procedure done. I have absolutely zero discomfort, zero pain from ibuprofen alone. No opioids, no narcotics, no anything. And I'm about to start. In half an hour, we're supposed to start a full day of patients and work, and I feel perfectly fine. So there's no need for the opioids. I think that's an awesome thing that he brought up, and this is all I'm taking. This is some Chloridex to kind of help keep the area clean. They did a bone graft in there to help preserve the tissue for an implant later on, and so that's what this is for. Now again, I said this video is going to get slightly graphic. And this is where, if you can't handle graphic stuff, this is where the first graphic part is going to be. And that is me. I want to show you this tooth. You're going to see it later in the video, but I want to show it to you now because it's kind of cool. And they packaged up this tooth for me. And you can see that inside of the crown there, you can see that little, it's like pink. That is called gutta percha. That's what they fill the root canal with, okay? And then you can see, this is the palatal root. You can see these little kind of pieces of string coming out of there. That is actually what they fill root canals with. So it's kind of cool to see the tooth kind of chopped up like that. And we'll talk a little bit more about the tooth later and why he had to do that. But anyways, I want you to enjoy this video. This is a really fun one. And again, I can't thank Dr. Forgaj and his team enough. Good news is we get to carry on with my journey now that stuff's out of the way. So enjoy the rest of this video.
Dr. Gary and I just went over what we're doing here. We talked about some potential sinus precautions. He thinks it's going to be okay. I'm just prepared for the worst. I know this tooth's kind of been a burden for 15 years of my life now. So, and it's kind of funny that I'm here in this office because Dr. Joe Hildebrand, his partner, did the apicoectomy. Apicoectomy is when we section that root off, so you can see where that kind of dark spot is right there. That was kind of backfilled with where that root used to be. So
time to divide and conquer.
Time to divide and conquer.
I like
So here we go.
Here we go.
We will recap. Maybe show you a little piece of the tooth or something afterwards if your stomach can stand it. So just maybe a graphic warning right here. All right. Anyways, anything else significant?
See you on the other side.
See you on the other side. All right, so Mr. Gary Forgotch and I just went over the treatment plan. It's Paige?
Yes.
Paige is getting me, put some topical on me. And now I just got to kind of man up and be tough. I think that's the toughest part, going through this injection here. So it's not too often the dentist gets an injection on himself. So I think it's good for us all. We should all do it on ourselves maybe once a month, once a quarter. So we'll see how this goes. Maybe I'll show you the tooth afterwards, but I can't film myself crying. So so we're not going to film the extraction itself, but I'll talk about it afterwards. All right. Quick update, tooth is out, I'm still alive. These are water syringes, so calm down. They did a fantastic job so far, honestly. They kept checking in on me, but that was a piece of cake. Yeah, truthfully, my workout this morning was a lot more strenuous and a lot more work than this was. They have an awesome strategy for anesthetizing the area. That was probably the part I was most worried about because I'm a little baby when it comes to needles. But actually, that was cake. Now, one thing we're gonna do.
He was a champ.
I was a champ. I was a champ
Did
here.
awesome.
Paige and Dr. Forgotch were awesome, and
Nancy.
And Nancy, I'm sorry, Nancy, I didn't get your name earlier.
That's okay.
But they did fantastic. We have like two sitting over here. I'm gonna show you in just a second. But
And a lot of
now what they're
pieces.
gonna do is because I'm eventually gonna have a implant placed there when I'm finished moving teeth. Is they're gonna preserve that bone the best they possibly can. Okay, there's the tooth. And so let's talk about that tooth really quick. So because you can see there's only two roots there because we talked about the apicoectomy, and we're going to take an x-ray just to make sure here in a second. But that
Palatal root, mesiobuccal root, crown.
Yep. You just tell them what you had to do. You had to section that crown, right?
Yeah, cut the head of the tooth off, and then we sectioned palatal from buccal and able to wiggle those guys out of there.
Yeah, exactly. Because that tooth, because it had that cavitation, it was brittle, it was just too fragile, and just the way everything was looking, it was just too hard to take that out at one piece. So it's just easier to section those sometimes, and that's where we're at. And so now what he's going to do is put a little graft in there so we can preserve the bone. So I have as much bone there as possible once we're ready to receive the implant, once I'm finished moving teeth. So I'm going to shut up here and let them continue their work because I'm sure they got more stuff to do today. And
All right,
we'll carry on from there.
Take a picture and I will.
You want me to try to get an actual picture in there?
Yeah, I have it. Okay.
Yeah.
Dr. Forgotch here, signing out. I got
Signing
get
out.
a little gauze pack, but this team did a fantastic job. I was worried, like I said, I was prepared for the worst, and this was cake, and he even put a little graft on there. I mean, I don't know, easy as can be.
Everything went great.
One thing I want to mention is that, can you talk about your ibuprofen, and Tylenol?
Yeah, post-op pain management, avoiding prescribing opioids when they're not needed. Most of the time they're not. Taking Motrin with Tylenol, synergistically they work very, very well together, usually even better than narcotic pain medication. So rarely are we prescribing we know the problems associated with opioids, so
That's right.
we don't need them, we don't need to prescribe them.
Absolutely. So I was very happy to hear him share that with me, and that's what I'm going to be taking, and I'm going to be back to work later today. That's how smooth this was. So again, thanks guys. Fantastic job.
So, our pleasure.
Yep.
Signing off.
Signing off.